But this is an important talk. There's been a lot of talk about consumer marketing, and I want to introduce Robin Berzin of Parsley Health. Robin started her direct care journey 2 years ago, so not that long ago, and now has a 3-location and growing entity, functional medicine-driven direct care entity that's in New York. It's actually bi-coastal with more locations. That's a direct-to-consumer business, and so she's been scaling that quite a bit, and so she's here to talk to us about how she's translated a lot of the concepts I think that have been touched on thus far into her business to help to accelerate the growth of her business to the consumer. Thanks, Robin.
Okay, great. Hi, everyone. Thanks so much for having me. I'm Robin Berzin. I'm an MD, and I'm the founder and CEO of Parsley Health as well. Parsley Health is groundbreaking care from doctors and coaches who get your big picture. And I fundamentally believe what I think we all believe in this room is that you deserve a better doctor. And I love what this gentleman said here earlier about your doctor working for you, because most people don't understand that today a lot of doctors don't work for you, the patient. They work for the payer, or sometimes the employer. So a little bit about Parsley Health. We started in New York City a little under 2 years ago as my beta, my MVP. I believe that we could do a monthly membership model. I believe that we could offer a functional medicine-driven type of primary care, which I'll explain a little bit about in a second, at a price point that people could actually afford, because functional medicine has typically been a very high-end luxury service offered by solo providers. And while it works beautifully as a medicine and has great outcomes, it wasn't moving the needle in terms of getting into the population that needed it. And so since then, we have launched 2 new centers in Los Angeles and San Francisco at the end of last year, where I think maybe other than the Cleveland Clinic Center for functional medicine, the largest functional medicine direct primary care practice in the country. And we do medicine a little bit different at Parsley Health. We offer advanced testing, so we're looking at things like your microbiome, your genomics, your hormones, your toxin levels, because we believe that we should get to what's going on with you today as opposed to waiting until you're sick and then managing that problem. We do offer primary care, so we'll write you a Z-Pack for that sinus infection too, but we also do nutrition and supplements, and every single member of our practice gets a tailor-made nutrition plan, supplement plan, recommendation for lifestyle change, exercise, meditation. We have a partnership with Headspace. All of our members get free Headspace app access, and every month we get a download from Headspace on the data our members are logging of thousands of meditation sessions, which is really cool to see. We include health coaching in the membership model because it's well and good if I, your doctor, give you a plan, and if you don't do any of it, it's pretty worthless. You don't get better. We don't get good data on outcomes. So our health coaches are certified coaches that work side by side with doctors and teams. We're completely data-driven. We've had a PhD in data science working with us from the beginning, and we have incredible outcomes data on major cost driver conditions, things like insomnia, PMS, eczema, IBS, and this is really early days. And then we're tech-friendly, to say the least, so we do everything online. We're telemedicine, in-person agnostic for the most part. I just believe that technology is the vehicle to bring you closer to your doctor. It's not the endpoint or the answer. Okay, so that's a little bit about Parsley, and I'm happy to talk to you all more about that later, but this talk today is about the UX of health. UX is user experience, so we think a lot about user experience in the tech world, of which I've sort of come from as well, but we don't think a lot about it in medicine, right? That's sort of not, we're thinking about the medicine, as someone also pointed out. We're not always thinking about the user experience, and the user in this case is our patients. And so consumerization of healthcare has become this fun buzzword, and people talk a lot about it. But I wanted to just break it down into what I think are 4 key points of what that actually means, and things that everyone should be aware of. What is consumerization of healthcare? Well, by this year, 25% of value-based payments will be based on patient satisfaction, solely based on HCAHPS, which is a questionnaire. This is for hospitals that people fill out after they leave. It's not a great questionnaire, to be honest. I just got sent it as I was discharged, and I had my baby about 2 months ago. And yet it's going to drive, this patient satisfaction score is going to drive a huge number of dollars, and already is. So that's one way, right? This is one way that we're consumerizing healthcare. We're making the patient's viewpoint on their experience count for money. Another way is that more than 30% of consumers own at least one health-connected device. So while wearables market hasn't had the penetration that market penetration that we like it will have. It's still early. It's still getting there. People are interested in this kind of technology. They're interested in tracking. They're interested in knowing what's going on in their own health, even if it's just having a connected blood pressure device at home. And then, of course, there's the dollar sort of overall. Consumer health is a $740 billion market that was projected as of this year. I think we'll coast by that very quickly in the next couple of years. And then finally, the primary care revolution is coming, which is what we're all here talking about. And if you guys didn't see the article this month in the Journal of General Internal Medicine out of some researchers at Harvard and the Brigham, they literally outlined a play-by-play recipe for direct primary care and frankly for what we've been doing now for 2 years at Parsley Health. So that begs the question, what does it mean to be a consumer-centric business? Because if if the patient is now paying you, the expectation is different. You can't just offer the medicine that you were offering before, and you can't do things the same way because the consumer expectation today, the bar is set really high. And it's set really high by these guys. It's set really high by Uber and Apple and Aero, which is security, and Squarespace and Airbnb and Amazon. When people think about their consumer experience, they're not thinking about healthcare. They're thinking about the bar that has been set through technology and responsiveness by companies like this. And so if you're going to then offer healthcare and not meet these sets of expectations and standards, you're going to have a disconnect. And so my fundamental premise in starting Parsley was that your medicine should work as seamlessly and easily as your iPhone. And we've done a lot of that at Parsley Health, and we're doing a lot more. We actually just hired a UX designer, and at Parsley we call it MX, which is member experience, and comes from Airbnb, actually, and is working with us to redesign all of our tech, even from where we are today. But it's really helpful to keep these experiences in mind when you design your healthcare experience, because again, your patients are going to expect, when they're paying you directly, for their experience to work like this. And that's really scary, but I'm going to try to make it seem a little bit easier and hopefully give you guys some takeaways to think about for the providers and for anyone who's thinking about what this should look like. So think about your member experience, your patient experience, PX, MX, whatever you call it, as more than features. So it's not just the what of what you do, it's the how, and the how you communicate that and how you present it. So first of all, it's brand. Parsley Health is a lifestyle brand, and that was very deliberate for me to begin with. I knew we had to be aspirational. We had to have a unique voice, values, and aesthetic, and I wrote all of those down, and we have an operating procedure for every Instagram post, every blog post, for what our voice feels like, how we communicate our information. It's conversational and credible in our case. I hope that you find your own as you think about your brand. You have to be responsive to truth. So things like NPS scores, Net Promoter Scores, is a survey. It's a one-question survey. How likely are you to recommend this or your doctor or your practice to somebody else? That comes from the consumer world, where this is used as, that question is felt to be the best gauge for whether or not somebody's happy with your practice. Would they recommend it to somebody else? And you can have people who are neutral, promoters, or detractors. We send these out regularly at Parsley for both the practice as a whole and for individual doctors who work with us. And we call and talk to and interview every single detractor, and even neutrals and even promoters, to understand what they like and what they don't, and why they're pissed or why they're happy. Relationships over rules. Give an inch, get a mile of LTV, which is lifetime value. So like in medicine, where I trained at Columbia and then Mount Sinai in New York. So that's, my background and my experience. But what I was sort of taught was like, this is how we do things. This is it. It's my way or the highway. This is how the hospital works. This is how the faculty practice works. That doesn't work with your consumers. They don't care about your red tape and your rules. And a lot of times you can get a mile of lifetime value if you give an inch on your rules, whatever those happen to be. So example, we had a member in our LA practice. She sort of had a weird life crisis that had nothing to do with Parsley Health, so not our fault. Didn't come in and use her membership, and wanted to restart it a couple months later because she had paid for the year up front, but she hadn't used it. The rule would have been, well, sorry, you could have come in at any time. You didn't. But we said yes, and we let her restart her membership, made her really happy, and now she'll be a promoter, and she'll send 5 more people our way, or 10 or 20, because 50% of our growth to date at Parsley is all word of mouth, our patients telling other patients, which, by the way, is free. And then proactivity instead of reactivity, just anticipating problems. So looking at your consumer journey, your patient journey, anticipate the sticky points, and as opposed to like waiting for people to complain to you, go through the experience yourself. Get your husband or your wife or your best friend or somebody who's going to be honest with you. I find like for our advisors for the company, I have them go through the Parsley journey, and then I have them get on the phone with my husband, and they'll tell him all the things that like they don't want to hurt my feelings and tell me, and I learn so much. So, and then that allows us to be proactive when it comes to problems in our user journey as opposed to reactive. And I'm sorry I'm like racing through this, but they told me this is a 10-minute talk, so. And so to actually execute this, like, what do you do, you know? Because I hate talking in platitudes and like, you should do this, Dr. So-and-so, and they're like, great, that's unhelpful. So these are the questions that you should ask. And this comes from not just me and like what I made up in my head, but also a lot of research around the consumer space, consumer tech, and we can send these slides out too, what people are teaching us, whether you're at Airbnb or Amazon or whether you're at your DPC practice, to ask, how should people first experience our product? That doesn't mean when they walk in the door. That means when they read your newsletter or see you on Instagram or hear somebody talking about it. That means that you have to know what you're about so that you tell your patients so that they tell other people the right thing. What is that touch point? How will they buy it? Thanks, Hint. Hint is helping that a lot, right? We're using Hint now at Parsley Health as of very recently, so that's very exciting. But how will they purchase this, and how will that experience be? If they can't sign up online and easily buy it and have that be easy the way that they buy everything else, you have a problem. How will they onboard? Like, what does that happen? It's not just when they walk into your office, do they know where to go, what to do before, what is expected of their journey? How can you tell them? We're actually redesigning our entire onboarding sequence right now so that people understand what the membership's about and get the most out of it. How will they receive support for it? You probably hired your nurse or your health coach or your lab person or whatever, and you didn't hire a customer experience person. Who's going to do tech support or help, and what's that going to be like for them? Because they're just going to be hiccups and glitches. And like when I was yelling at the lady at Delta today, because I'm like the most impatient person ever, and I needed this thing to change, and she was really nice about it. That made me, like Delta even more. But do you have that person who's going to handhold your patients or your members through that experience? What are the series of touch points they'll receive along the way? You might be awesome as an individual, but what are the other touch points? What's your office like? Who are the other people who are working with you? What kinds of follow-up do you send them? What kinds of information do you send them? We're building out an incredible way of visualizing data that will allow our members to have incredible amounts of touch points in between visits, which is really exciting. And then who on the team owns all of the above? Who's in charge? Who on your team owns this? We have a director of member experience at Parsley. So who is like actually thinking about these things every day? Because it's not okay. You can't just like think about it once before you open and then like never think about it again. And last, I'm talking really fast, I'm sorry. The how. So 6 ways to create better UX or PX or MX or whatever you're calling it in healthcare. So I recommend creating SOPs, standard operating practices or procedures for patients, not just your doctors or your healthcare providers. So what is going to happen as your members or your patients go through their journey? Write that out. There should be a series of steps that you expect to happen. And then you should, if you know you can't manage what you can't measure, everyone says that, but it's true. Then you have a series of steps that you're measuring against. Did this happen, this happen, this happen, this happen? Shadow and shadow some more. I can't tell you how many people, especially from like tech, they're like, I'm starting a healthcare service. And I'm like, have you ever shadowed a doctor? Somebody was telling me they're starting this like One Medical for pediatrics or something similar to that a while ago. And they weren't a pediatrician and had never spent time shadowing pediatrics. And that company didn't do so well. So there's a really important, shadow your coaches, shadow your lab managers, shadow your other doctors. Like understand literally what is happening in those moments. I shadow our doctors remotely via secure video who are practicing in LA and San Francisco when I can't, I'm based in New York, so when I can't be there. Create a feedback loop. So what is the mechanism by which your members are going to give you feedback? How are they going to tell you whether they're happy or unhappy? Don't assume that the squeaky wheel is the only squeaky wheel. The squeaky wheel is the tip of the iceberg, and underneath that are all the people who are too busy, too annoyed, or like kind of meh to like actually give you feedback. So don't assume that the one person complaining who you can write off as kind of crazy, because we've all had those patients, and oh, that's that person. No, there's a lot more under the surface. And how are you, NPS scores, feedback loops, asking for feedback, questionnaires, having other people in your team call them. What are ways that you're operationalizing that virtuous cycle of feedback? I believe in this deeply, and not everybody does, and so maybe this one is up for debate, but for us, brand is very aspirational at Parsley Health. People aspire to be a Parsley member. They see it as like being an Equinox member or having something that's really special, especially for people who are into kind of health and wellness, who are our initial early adopters, although we'll scale way beyond that. But for me, it was really important to start out as an aspirational brand. People have to want this. We go from a world where healthcare is this thing that you kind of ignore and forget about and don't actually, want to engage in, and then you're going to tell people to sign up for a year and be your patient. You got to make them want to engage with you and come in. They have to aspire to something that you're offering. Care is caring. At Parsley, we're putting the love back in medicine. I just think that there's so much room for like genuine, authentic human interaction in medicine that just got, lost along the way. I think I had excellent training at Columbia and Mount Sinai in how to be a clinician, but I didn't, have great training in how to connect. And some of the people that I saw being rewarded the most in those settings were not the people who were really connecting with their patients. And so we talk a lot about bedside manner, but what does that mean? Just allow yourself to care and allow that to come through, because that relationship will mean more to your patients than anything else. And then lastly, the model is inclusive. So just remember that you probably have a model and operating procedures and everything else for this idealized version of the patient. But if you're in primary care, it's all comers. And there's two sides of that coin. Like, Parsley Health is not for everyone. And to the competitiveness angle, to me, it's like our TAM, our total addressable market, is all American adults. So we have a lot of room. There's a lot of room for a lot of players in the space. There are going to be a lot of big ones, and there are going to be some small ones, and that's fine. This growing, which, let's grow the size of the pie, is how I view it. But model is inclusive means that don't create something that totally doesn't work for different types of people. Understand that you have to have some flexibility and create something that's going to work for different types of people, because, in our case, when a woman who's married and signs up her mom and her husband and then her sister, her mom and her husband or sister have already heard that she loves Parsley Health. But the way that it has to work and how we have to be responsive to mom and sister and husband might be a little bit different. And so make sure that your model understands the people who are coming to use your service. Okay, so that's it. That's our a shot from one of our offices, our old office actually in New York. That's one of our doctors. If you guys want to ever come visit us in San Francisco or LA or New York City, please do. Our offices are very deliberately beautiful, non-clinical, have Moroccan rugs on the wall, feel nothing like a doctor's office, a lot of plants. And that's our vibe and that's our brand. And if that's not your brand, you're not doing something wrong. Just whatever you do, know what your brand is. Thank you.